if someone can hold this to the table. So then I'm going to grab above the medial and lateral malleolus and do a little traction. How's that feel? Right. Okay. Could you come a little bit, actually, relax for here. Come a little closer this way. Yeah. Because I've seen people who are really limited in extension and they can't extend the knee at all. Maybe I can only, let's just say, extend to here. So what I'm going to do is a lot of traction and just twist. So a big traction, like I'm leaning back, I'm pushing with my front leg, and it's usually kind of painful. You kind of work your way into it, but the more you traction and the more you rotate, sometimes you'll even hear a click, and often I think that's kind of like getting that posterior horn or that bucket handle tear. You're just kind of flattening it. And you just keep on going further and further into extension. And eventually between this traction and rotation, maybe you flatten that tear. And then they can do the repeated knee extension resets and hopefully keep it from deranging again or sticking up into the joint space. So you try to get it to the point where you are going into a little bit of hyperextension. So that's my variation. Better. Right, but I think you might need that to desensitize this a little bit. So I'm going to do, for more internal rotation, and distally I'm going to do tibial external rotation, and then I'm going to bring it into extension. How's it feel? Better. Yeah, of course. Doesn't hurt? A little bit at the very end. Okay. So I think if you're going to do this, you can't obviously reach distally, but you can do this, because you were doing this. Yep.